Welcome to the Rehab Links Secrets to Success podcast. I'm Lisa Chase, your host, and today I have a very special guest, Dr. Logan Cooper.
Hey,
Hello.
buddy. So good to finally be here.
We have been wanting to do this for so long, and I'm so glad that we finally were able to pull you away from all the different things that you're doing in your life that I know you're going to share with us. So Logan and I have known each other quite a long time. We met at Michigan State and have been teaching together for years. And then, of course, we just became really great friends. And together, we've gone through several different business coaching programs together. We're currently going through one now. And he just has a lot of unique insight. So I'm excited to have him share. So you are in Maryland and also in Virginia. You've got two clinics. You've got the orthopedic manual therapy specialist, right? And that's in Germantown. And then you have the Beta, right?
The Beta PT.
PT, yeah, which is servicing rock climbers. So I know you're an avid rock climber, so I'm definitely interested in hearing a little bit more about that. So, and I know that you have a huge, beautiful family of 6 children and a 7th on the way. So
that's right. That's why it's been so hard for our schedules to line up. As soon as I think I have a schedule set, something happens, another domino falls, and no, sorry, Lise, we got to push it.
And then you're also the co-chair with me at Michigan State for our certification program. So we do spend a lot of time on many
different time together, but never enough.
No, I know, it's so true. So, well, why don't you give us a little bit, of a background so the listeners have a better idea of kind of, where you have been and your types of practices and, about your journey.
Sure, I'm happy to. Thanks again for having me. It's so exciting. Anytime I get to spend with you, I love it.
Me too.
And we do go way back, probably at least, I don't know, 15 years, maybe.
Yeah.
We've been teaching together for 7 or 8 now.
Yep.
But so I've been a PT for about almost 20 years now.
Okay.
And then went through the typical kind of mill practices where you're treating 3 people an hour for 8 hours a day, no paid lunches or anything like that. And I just got so burnt out. And after going through the Michigan State training, and I really wanted to focus on my manual techniques, I realized that takes time and focus. And it really works if you could give that attention to the patients. Yeah. So after, I don't know, 5, 6 years of just spinning my wheels and trying to make it work within the hamster wheel, I just knew that I couldn't do it and wanted to do my own thing. And it took me a while to get there, but I've had my own practice now since 2014.
Okay.
And it's been going well. It's been going very well. That's the Germantown, Maryland one. So that's patients primarily who have been in just a lifetime of back pain, neck pain, you name it, we see it. They've typically been in pain for long enough time where now they can't sleep anymore. Right. That's typically when they come to see me. And then I started. Oh, go ahead.
And you also see a lot of headaches, right? Chronic headaches.
I do. I see a lot of patients for what we call craniofacial pain. So anything, headaches, jaw pain, neck pain, if your head feels heavy on your head, or just, you just want someone to just rub back here forever. Typically that's connected to a headache. Yes. And I see a lot of people for their headaches and jaw pain. And actually another part of my business is working with local dentists where I treat their patients before they get any night guard appliance adjustments, or if they have any kind of oral appliance to widen their palate, that kind of thing. I look at their head from a functional point of view to make sure the appliance allows for their head and the cranial system to go through its normal rhythm. Just because the appliance might be level in their bite doesn't mean it's a good functional fit. So they bring me in to make sure, to help support them in what they're doing, and we've been getting great outcomes.
Yeah, that's a huge benefit to any dental practice and to a patient that is suffering with any kind of, head, neck, and, TMJ.
Yeah, it's a very holistic approach, which it's not common. A lot of times we get very myopic in our and our specialty, and we lose sight of the whole patient in front of us. And it's really nice to work with providers who understand that the person coming in is not just a diagnosis.
Yep.
It's a person who has jaw pain or who has headaches, and then they have a subspecialty that allows them to help a part of that, but then they can bring in other people to look at the whole and address the person and not the diagnosis. And it's so nice to be part of that group.
Yeah, talk a little bit about, just for our listeners who may not really understand kind of the cranial system and how it impacts jaw pain and, the any kind of, mouth guard or things like that, that, are impacting, somebody's pain.
Sure. In a very simplistic sense. So everything's connected and it all counts, right? So we absolutely look at everything, but if we're just going to focus on this area, you want to think of it in 3 different parts. So it's how the head and the neck work together, how the head and the jaw work together, and then how the teeth come together. All that needs to be in balance for the system to work well. Because if it's not, then other areas get overstressed and start to break down and become painful. And just a really simple way to test that is what I call it's a craniovertebral bite test. So if you just look straight ahead and you tap your teeth together, get a sense of where that first touch point is. Okay. Then if you let your mouth relax and look down, sit just how everybody tells you not to, just slump, and then tap your teeth together again. If you notice that position changed a little bit. Now, if you keep your mouth just relaxedly open and look straight up to the ceiling and tap again, you can feel that the bite changes just a little bit. So that's how we can influence the bite position just from the change of your head on your neck.
Right.
And that's why we want all of that. Again, it's more complicated than that.
Sure.
But that's a kind of a quick and dirty way to appreciate the influence of other areas and how it can affect the bite.
Yeah.
So that's what I do.
Yeah.
I just balance everything else out and let the dentist do their thing with the bite.
Right.
And I take a look at the rest of the person.
Right. Excellent. So if somebody has a device, is it better to go prior to having that done and have the head worked on, or what is your experience that you find is most beneficial, or is it after, or is it maybe it's both?
Yeah, it's a really good question. So a lot of times I'll see people before, especially if it's a new appliance that they're going to get molded for, because I want their system to be as pliable and vibrant as possible. And then the appliance will help support that. So then I'll see them typically before, and then anytime an adjustment is made, I'll see them right after.
Yeah, and that really makes sense. It's just like somebody who might have to have surgery, right? Like
yeah, totally.
lumbar surgery, right? We always try to clean up all the mechanics, so we get things as good as we can get them before the surgery. So that would make sense. That's the same thing. Okay. All right. So you've got the practice in Germantown. So now tell us about your climbing practice. I know that's super exciting and something you've been trying to get off the ground.
It's like I could work a 12 or 14-hour day and come out just jacked. Like I get so enthusiastic and excited about working with that population. I started that probably 2 years ago, just a little over, and treating out of a company called Sport Rock. It's one of the oldest climbing gyms in the country, and they're based out of Alexandria. Started treating their directors and a lot of their staff, and then their junior team, and then they expanded to make a climbing performance institute, and a ton of high-level rock climbers from all over come there to train. And I have a practice within that, and so I'm the head therapist within their climbing performance institute. It initially trying to speak 2 different languages from a practice point of view. So I know a lot of your listeners are clinicians and potentially business owners, right? So ideally you want to have your business avatar, right? Your person. So you speak to your one person, and that person says, oh, they're talking to me. Like that's me. What you're doing is for me.
Yeah.
Trying to do that for a person who's been in this insufferable amount of spinal pain is very different language and emotion and connection than somebody, a teenager looking to perform and stay at a high level of rock climbing.
Yes.
So because of that, I created a whole separate practice and a whole separate business, because the same business couldn't speak 2 languages.
Yeah.
And it's been an adventure in trying to run two different businesses at the same
Yeah.
time. And you would think it's the same thing. You're just doing the same thing in a different place, but it's a whole other language. It's a whole other system of operations.
Yeah.
It's been very interesting.
It's very, very, different. And even the mentality, right,
Absolutely.
of your patients, which is that athlete mentality. And I know you're an avid, you've been rock climbing for a very long time. So, when you have that personal experience and what maybe you've struggled with when you've gone rock climbing, now you can bring that, to, the patients and your athletes in that practice. So I think that's really cool to have that personal connection.
Yeah, absolutely. And that's where the being able to speak the language comes into play, right? Because I know I can relate to my avatar, to my person that I speak to, that one person, and it definitely helps the connection. And it's something that I'm passionate about. And I
Yes.
think people pick up on your passions
Yes.
indirectly, that your body language, your energy, your just your enthusiasm, so much comes across non-verbally
Yeah.
that it really reinforces that connection. And people know, okay, I'm in the right place. Finally, someone knows what I mean when I'm talking about a certain move and is not telling me, well, just stop climbing.
Yeah.
It's like telling a runner, we'll just stop running. Or
That's right. That's right. An
this
athlete
doesn't
never
happen.
wants to hear that. You got to try to keep them in the game or, some kind of active lifestyle while they're going through their
Totally.
rehabilitation.
And I know you have a ton of experience working on the tour with tennis players and all your athletes. So I'm sure you understand.
Yeah, absolutely. And then I know within both, I think both your practices, you have newbie and several different technologies, right, that you're using to help kind of speed that healing and get,
Yeah,
better outcomes,
totally.
right?
Absolutely. I've never been a big modalities guy. I
I
think
know.
we've spent decades and decades mastering our manual therapy craft. Right?
Yes.
So I've always felt that I could get so much more out of 40 minutes of my hands on somebody than I could an ultrasound or
Yes.
something else. And then I came across newbie
Yep.
from you. You've gotten me into so much trouble. I always tell people that if Lisa's calling, just tell her I sign up. I'll do it. Um, but the newbie has been one of the biggest game changers I've ever come across, and one of the only modalities I use in the practice.
Yeah.
The newbie, we also do a deep tissue laser,
Yep.
and we've gotten into a lot of blood flow restriction training lately,
Yes.
and I love it. The combination of those three modalities
Yes.
with the manual work,
Unbelievable.
it's been the best all-encompassing approach to patient care that I've ever come across and ever really instituted into the practice. And
Yeah.
again, I've been doing this for almost 20 years. So now to finally figure out those missing pieces
Yeah.
and get the nervous system to change and learn about it, it's just so we can correct the mechanics all day long.
That's right.
But if the nervous system doesn't understand that it's now safe to move,
Yes.
it's going to default to its known protective state. And
Yes.
that's where newbie comes in, and we can change the neurology and change the system from the input level. And
Yes.
then we can get our BFR on and start to load these tissues in a safe way without having to put an excessive amount of stress on them, but still get the hormonal stimulus, right? And that combination is
No.
it's lights out. It's awesome.
I know I don't know if you personally been doing it, but I always like to try things out before I bring
Oh,
it
yeah,
into my practice. And
absolutely.
I've been super consistent, and we just brought in the in-body
Nice.
body composition. And in 3 weeks, I gained 1 pound of muscle, and I
Awesome.
decreased, like, I don't know, almost 2 percentage points of, body fat. And it was predominantly, I've just done like 20 minutes of doing the BFR, and I
Yeah.
boosted my, protein intake. And it's like, wow, in 3 weeks, that's so, when we went through the training, it was like, okay, does this really work? And then now I'm like seeing the changes in a very short
So
period of time.
cool.
So
That's
it's very
awesome.
cool.
Yeah,
Yeah.
that's great. And those are the kind of changes that we're looking for.
Yeah. Yeah.
It's
Our
awesome.
patients love that, right? Because,
Yeah.
people don't have time to exercise oftentimes, or they hurt, they can't lift heavy. So
Mhm.
the combination of, the manual, then with newbie, and then the blood flow restriction. Yeah, I'm with
Yeah,
you. It's a
that's
great
awesome.
combo. Well, awesome. Well, let's jump in to, I know you've got some good tips for us, right? About how you get great clinical outcomes, because ultimately that's what our patients are looking for. And that's what clinicians are really wanting, right? And I know many of our clinicians might be, restricted because of time within their clinical practice, but, share with us, what you feel are your top three.
I've been thinking about these since you started your podcast. I've been listening to everyone, and I have this active note on my phone that I could be waiting at the airport or a traffic light, and I'm just writing down what I want to say to Lisa. I just got back from teaching with Carl. We did Muscle Energy 2, Advanced Muscle Energy up at Michigan State, and I think the biggest theme that he and I tried to instill in our students there is to be clinically honest.
Yes.
And I think that there's so many different treatment approaches out there. You could be a McKenzie or a Maitland or a Mulligan or an osteopathically based or whatever you do.
Right.
And that's fine. They all have great application, but regardless of what approach you use, be honest and test and retest and say, did it work? Just because maybe you did a thrust manipulation, you got a great pop. So what?
Right.
Did it change what you were looking to change in the way you expected it to change based on what you've done up to that point? Because you and I have both had patient cases where we've done things that we know should change the system.
Yes.
But didn't. And then we have to step back and say, why?
Why?
The great case in this is I just had a guy, I've been seeing him for years, off and on, avid kiteboarder, rock climber, really great guy. He had some upper lumbar restriction. And I tried for 3 sessions, and I couldn't budge it. I couldn't change it. He had adverse femoral nerve tension. He's getting numbness, tingling in the inner thigh. This is L2, L3 region. And I couldn't get a good spring on that L2, 3. I couldn't restore normal mechanics. I was like, buddy, something's not right. I don't know what it is, but what I'm doing isn't working, and it should at least change something.
Yes.
So I had him get an MRI, and they found a mass in his spine at the L2-3 nerve root, compromising it on the right side. And they're checking in for potential lymphoma and all these other things. So that could have saved his life.
Yeah, absolutely.
And we never would have come across it if it wasn't just a matter of, okay, did he respond the way he should have? And maintaining that clinical honesty, I think, is just key.
Yeah, and that's something, Carl instilled in me so early on. And I've had similar cases, where, 2 to 3 sessions, either they're not getting better or they're getting worse. And that is when you're like, okay, time out, because if there is a certain expectation of how the musculoskeletal system should respond, and if it doesn't, then, then you got to stop and you got to step back. And I totally agree. Like
that stuff can walk into your clinic.
Oh yeah, and I've had it many times.
Absolutely. And the longer you do this stuff, and I was listening to Galen's podcast.
Yes.
That hit when he was a guest, and I think he said something that was so incredibly accurate, is that the longer you're doing this and the better you get at this stuff, the more complex patients you see.
Oh yeah.
And that can sometimes it can present as a musculoskeletal issue, but not be. So to be honest with that always is my number one key for any kind of professional success, is just be honest with what you're doing.
Yeah, that is so true. And sometimes it's actually not even the musculoskeletal system. It's just responding through the musculoskeletal system, and it can be whether it's like what you found, or sometimes somebody's nervous system is so under threat by so many stressors that the littlest thing would make them worse. That doesn't make sense, right? And then, okay, and then we have other tools for that, where we're, working with the newbie, to do like master reset, and, trying to figure out what is the best intervention based on, what they're finding. So, yeah.
Totally. Yeah. It doesn't, just because something doesn't move doesn't mean you just push harder.
That's right.
Yeah. That's awesome. Yeah. And that's the number one thing.
Yeah. Okay. Good. Number one. Got two
Second
more.
would be find a group of people that are as passionate about what you do as you are. I mean, I've been so lucky in my career to find you, find Carl, Mark,
Yeah.
bless Mark, the whole crew up at Michigan State. It's been such a great family to be a part of because we're all just so passionate about this profession and what we do. And we support each other, we challenge each other, and to have that community
Yeah.
is so important,
Yeah.
and not feel so alone and overwhelmed by just taking on your patient's issues and never feeling like you're good enough, and like the imposter syndrome and all these things that still tickle the back of your brain,
Right.
and having a group of people to explain that to and to challenge you in what you're doing, and encourage you to be better and support you when you fail. And that's to be part of that community, and to have that is so important.
Yeah, it's so huge, and I think that that there are not a lot of clinicians that maybe have that, right? I mean, really
Mhm.
have that strong community. So yeah, I mean, finding that, whether it be, through teachings like what we're doing, or, different organizations, that's been a huge impact. The people and the clinicians in my world, absolutely, push you and make you want to be better.
Yeah. Yeah. It's just, it gives you that extra motivation and that extra support that it's like, for me, is hard. I tend to be an internally driven person, but when I know, like, oh man, I need to know my stuff because I'm going to go teach with Carl,
Right.
and he's going to hold my feet to the fire, which is what I need.
Yeah.
Right? And that just, it helps me really focus on my anatomy and focus on on the basics, and it brings
Yes.
me back to all that. And I think if we can get that support and that extra little push, is just so crucial, and then that leads to better clinical outcomes.
Yeah, absolutely. Yeah, I think you tend to push yourself more when you surround yourself with associations that are either in that same mind, space, or, they're maybe even at a higher level. Like when I first started teaching, I remember teaching with Mark and Carl, and I was just like, like, how am I ever gonna like compete with these guys? But it drives you to
Oh,
be better, like you said, get better at your anatomy, and how you present. And Carl always used to say to me, less is more.
yes,
we
man, I've
we
been on the
we both
receiving end of
had
that
we
many
both had
times.
that reminder from Carl, haven't we?
Absolutely, and several others. But that's just been, it's just been so crucial to my development.
Yeah.
And I would wish that on everybody, that they can find the people that make them better. And
Yes.
then you can give back to those people. Like we're teaching each other things all the time. And
Yeah.
Carl's been doing this for 40 years, and I showed him a new technique this past course. And it's like,
Nice.
we're still so excited to learn this. And I just hope that everybody can be a part of a community like that,
Yeah.
because it's a tough job,
It
and
is.
it takes a lot of practice and a lot of dedication, and you're dealing with people in pain, and to
Yeah.
have a group that is your group for support and encouragement is just, I wouldn't trade it for the world.
Yeah, I agree. It's a great one. And
My last one would be for top three, and this is for those clinicians who are maybe starting out on their own practice, things like that, would be to fail fast.
mhm.
I for the first several years of my practice, I was in the same building as a DO, and he had an existing practice. I came in and kind of worked under him for a while, and then started my own practice in that location. We just shared staff, but they were always technically his staff.
Yeah.
And he was very old school, paper charts, handwritten documentation. But I thought, well, this will be safe. Right. And I guaranteed in like referral source, all these different things. It was very safe.
Mm.
And I did that for years until I realized that there were just things that I wanted to advance and I wanted to try and do that I couldn't.
Mm.
So then I left that practice and just moved 7 or 8 doors down in the same complex. But now I'm officially on my own.
Yeah.
And I've been in that location for a few years now.
Yeah.
But in the first 2 years of that, I failed more,
Yep.
but grew more at the same time than in 6 years of being in the safe location.
Yep.
And I only wish that, man, I wish I had made these mistakes 10 years ago.
Yeah.
And so if you're going to fail, just fail fast. Make a decision, act on it. And if it works, great. If it fails, okay. Reassess and move on. So if you can make those decisions and those early failures, you'll be so far ahead of the game. You'll learn so much from them rather than always playing it safe.
That's
and
right.
Careful.
And I think as a clinician, many of us are afraid to fail,
Oh
right?
my gosh. You have a family at home. You have patients that you're caring of.
And
So
that,
much depends on your ability to not only get people better, but to make the right choices and earn an income.
absolutely.
And it's a lot of pressure.
Yeah, it really is. And really understanding that underlying why you may be afraid. So I know you're going right currently through the hero's journey.
I am.
Right.
Yeah,
And
totally.
that is an amazing program by Darren Hardy.
Oh, I love it.
Went through last year, and it was so impactful in my leadership and personal development. And I think, part of figuring out, like, okay, it's okay to fail is understanding some of those underlying, issues. And, so finding a program that really helps you explore more, and Darren talks about that all the time. And even Greg, same thing. It's like, it's okay to fail. And actually, those that fail more succeed more, right? Because
Exactly.
they push
Yeah,
the boundaries.
totally. And so,
Yeah.
not that I wish failure on anybody,
No, of course.
but
But
if you're going
yeah,
to do it, just do it quickly. That way you can recover faster and you can learn the lesson and move on.
yeah.
Um, yeah. And another thing, if I can add one more, if
Yeah,
there's
of
time,
course. I love it.
I listen to the M.E.L.T show a whole lot.
Yes.
I know he's the mentor of our business mentor. And there was something that he said the other day. He's, when a mistake happens, rather than saying, "Oh man, I'm such an idiot," or "I'm so stupid for making that mistake," I know I have that internal dialogue,
Sure.
whether it's like a game of chess or it's something else. I'm like, "Oh man, I'm such an idiot." I've really tried to turn that around since hearing what he said, and what he does is when he makes a mistake, he says, "Wow, that's not like me." And
Mm,
he removes himself by saying that. You remove yourself from the mistake
right.
and you understand that that mistake does not define you. That's unlike you.
Right.
So you remove yourself from the mistake, but allow yourself to learn the lesson.
Yes.
And I think that internal self-talk has made a huge change in myself. And when I make that mistake, whatever, I'll go down that road initially, and no, that's just unlike me.
Yeah.
And then I'm reinforcing to myself that negative behavior, that negative outcome, that's not me.
Right.
That's very unlike me, but I can learn from it. And I think that's such a cool lesson.
Yeah, that really is. And it's really about mindset, and
Totally.
self-talk. So yeah, I haven't listened to his podcast. I'll have to check it out. Really.
It's awesome.
There's
I
so
end
many.
up saving almost every one of them, but there's a few that I listen to almost daily, if not definitely weekly,
Yeah.
because they get me in the right mindset. And after going on Hero's Journey and understanding how important that is,
Yeah.
it's been great.
Yeah.
Highly recommend it.
Awesome. That's awesome. I'm excited that you're going through that. So we'll have to talk more about it for sure.
Oh yeah, it's great.
So so I know that obviously, we teach together, you teach your patients, you have your own particular audience, right? And so tell the listeners, like, what do you think that you bring that your audience really appreciates? Are there any tips that can kind of come out of that process through sharing your knowledge with others?
I think kind of self-reflection is always the hardest, and trying to pick out our good things is
You have
always
lots
so,
of them.
it's always so hard. So I actually went back through and looked at what some of the student evaluations
Yeah.
said, and kind of two themes came across is that I'm passionate about this. I love what we do. I think we're so lucky to be doing this, and then to be able to teach it
Yeah.
and then influence the lives of other people through that is just awesome.
Yeah.
So I think we're really lucky in that. I think that passion comes across. And then I'm just as simple as it gets. So I can take these complex themes and principles and just make them very simple.
Yeah.
And that's the level where I like to operate. It's just so simple.
Yeah.
That's
Yeah. Yeah, those are great. And I've, in teaching with you, I can say I can definitely, see that. And, it's and we've kind of watched each other grow over the years, right? With our teaching style and yeah, and that's been cool to see.
no, it's been awesome.
Yeah.
It's been so great.
Cool. Well, is there anything else of value that you have? I know that you've been working on a headache program, and, some different, opportunities maybe to share with our listeners. Is there anything else that you'd like to, bring a value to them?
Yeah, totally. I know we have some Michigan State
Dis-
discount for
Yep.
courses, right? So
Yep.
that I would say, please take advantage of.
Yeah.
It's an awesome experience. And so that would be the first one.
Yes.
And then I'm working on the final touches of a virtual headache program, and primarily for patients who have what we call cervicogenic headache. So there's a lot of different ways headaches can arise.
Right.
Very frequently though, and what I found is more frequently than what the literature would say, there's a neck component driving that headache.
Mhm.
And that specific subgroup of patients suffering from headaches, I can help very well virtually and make a big difference. So I'm trying to expand that reach and help as many people as we can. So I'm trying to put in the finishing touches on that program. What I can do is give you I made a checklist of questions to know, are your headaches even coming from your neck at all?
Oh, that would be
Just 10
great.
quick questions. And if you answer yes to any of them, chances are your neck might be involved, or at least contributing to your headache, and it might be worth a talk. And it's a free talk. There's never any charge for that. Just to sit down and say, okay, tell me a bit about what's going on. It might be affecting your headache. So if you either have patients out there who have what you think might be headaches coming from their neck, you can use this questionnaire, and it might help guide you in the right direction.
Oh, that's fantastic. Yeah, we'll put that in the show link, a link to, to download that. That would be
Great.
awesome. Yeah, definitely send that to me and
Yeah.
we'll share that out. Cool. All right. Well, then tell us how we can find you. So if people want to reach out, I know we'll have your, your website in the show notes, but main way that they can get in touch with you.
The best way is probably email, just
Okay.
drcooper at omtspecialists with an S at the end there, .com, or drcooper at the Beta PT.
Okay.
You'll have all those links. I'm working on more of a social media presence.
Yes.
I am on Facebook at OMT Specialists, Instagram, same account, OMT Specialists. Working on some more climbing related content as well for the Beta PT. So it's out there. Either venue works fine. I get right back to you. I'll answer everything personally.
Awesome. Well, I so appreciate your time coming on to the show, but more importantly, your friendship. So,
you're the best, Lisa. You know I love you.
Best. I know. Love you too, buddy. All right. Well, until next time, keep getting great outcomes.
Cheers.